I think that every school, no matter, and I talk to a lot of colleagues who go to school at the U of A, U of T, the States, and Australia, not just University of Sydney, but Melbourne as well. So I know people from kind of all different areas that went to dental school and have practiced or started practicing. And I think the common consensus is that it doesn't matter where you go to dental school, you're never going to feel completely prepared for the real world. Because at the end of the day, dental school gives you the basic foundation for which you can build your skills and go off on your own and do basically not quite the bare minimum, but um, set you at a level at which your competence isn't going to harm the public. It doesn't mean that you'll be great. It doesn't mean that you'll do amazing things off the start. And if you are one of those people who are able to do those more ambitious procedures, then all the power to you. But I find that a lot of students graduate with a little bit of imposter syndrome from the day they get into dental school, from the day that they retire. I think that just has to do with a lot of different factors because at the end of the day, we're working with people and people are variable. Medicine is not a direct, math where like one thing leads to another. You could do everything perfectly and still mess up. And so I think that it's difficult to say that you're ever truly prepared. And even myself, having graduated a while ago, there's still some procedures, some days and patients, even like the most basic things sometimes that catch me off guard. And I don't think that makes you a bad dentist. I think it just means that you're still learning. And that's why they call it the practice of dentistry, is that you're always learning to be better every single day. And you're trying to improve. And I think that's the mindset that you have to take into any career, but especially dentistry, because it's so variable. And so in response to the course load, like I think it was a lot, but not so much that was unmanageable. I think you learn to adapt and you learn to grow just like you will when you get into the real world. And I think at every stage, there's always going to be opportunities for growth, and it's going to be a learning curve whenever you start something new. So the first year of dental school might be challenging because you're not used to that rigor or that curriculum. And then towards the end of it, you're now juggling classes, you're juggling patients, you're juggling graduating requirements and things like that. And then even when you graduate, it's like, well, you used to have 3 hours for filling in school for one filling, and now you have to do it in like 30 minutes or an hour or something. It's not really comparable. So you're always going to have to find that you're going to have to grow and learn quickly and adapt on your feet. But it seems daunting at first, but you'll get there. So it doesn't matter how rigorous the course load is. It is a lot, but it's not unmanageable. And at every step of the way, I think that you have the capability to learn and to grow. And I think that if you are accepted into the program, it's because you have that talent, that capacity, that intellectual and academic potential to succeed. And they wouldn't accept you if you didn't.
That's awesome. That's a really great way to look at it, Tyler. Anything to add to that or expand on? Tyler covered it. Awesome.
Yeah, I completely agree. And I'm also experiencing a little bit of this as well. Just merging from first year, pre-clinic when we're working on dummies and then working on ourselves and then slowly integrating that, um, what we've learned on patients. So yes, we're not always fully prepared because every case will be patient dependent and every patient is different. They have different lives, they have different factors that lead up to their ability to, for example, take care of themselves or even just any type of dental oral disease that they may have. But they do help us in terms of having the basic knowledge to get there and their ability to answer our questions and have us think a little bit further and how to integrate our knowledge to help the patient in front of us.